I'm Dr. Aarthi. I'm Senior IVF Consultant at BabyScience IVF Clinics in Lajpat Nagar and Gurgaon. In this video, we are going to discuss about precautions post-embryo transfer. All of us know in the IVF journey, embryo transfer is a very important and the final step. And in the clinical practice, day-to-day practice, what we see is both the to-be parents, the couple and their relatives, they become very apprehensive after the procedure, like what to eat, what to do, what not to do. So in few simple points, I'll just consolidate and try to answer all these queries now. Number one, what I would advise to all the couple is that they should be relaxed and stress-free, because they're stressing out or becoming apprehensive about what is going to happen is definitely not going to increase the success rate of the IVF. So better to be relaxed. Number two, we advise prescription for the next 15 days so that the embryo can attach and then grow. So meticulously the prescription of medications has to be followed. Then comes the diet. So diet, what all precautions has to be taken? It's always advisable to take home cooked food, better to avoid anything from outside, and we generally advise very few restrictions like raw papaya or very much of spicy and oily diet, and nuts can be taken, and lot of fresh fruits and vegetables can also be taken. Next comes rest and then work. So is it advisable to take complete bed rest all the time? That's a definite no, because this is definitely not going to improve blood supply anywhere. So if somebody is not working, their household activities, whatever is possible, it's definitely recommended so that you can do that. We would avoid a strenuous activity or some activity that puts lot of pressure in the abdomen or heavy weightlifting has to be avoided. Now what happens to someone who travels for work or who goes to work? If possible, during the embryo transfer or following that 2 or 3 days, if rest is available, that is fine. Otherwise you can resume your work, because taking rest, as I told previously, it's not there are a lot of studies also that have proven that it is not going to help us improve the outcome. Then comes exercise and yoga. So what is the recommendation? See, if you are doing some light stroll in the park or moderate to less intensity exercises, that's totally advisable. It is definitely not advisable to do high intensity workouts and exercises. That is not recommended. Next comes, even we have doubts like how do we sleep? Do I sleep straight or do I sleep in the left lateral or right lateral? See, whatever is your comfort, you can definitely do, because this also again doesn't have any relation with the implantation or the success rate. And at last, it is generally recommended to avoid sexual intercourse, because what happens after sexual intercourse is uterine contractions are induced. So it is better to be avoided for the initial 15 days. Thank you.